This application alone of the metazone process has enormous profit potential, and the treatment will have vast international demand as the news spreads. This has not gone unnoticed by various investment analysts. A confidential report from Zurich Penny Stock Insider and Low Price Stock Edition, among others, are urging their readers to get in on metazone now, comparing the opportunity to getting in on Xerox, IBM, or Polaroid when they were still unknown. Various physicians have independently discovered ozone to be effective against cancer, leukemia, arthritis, coronary heart disease, arterial circulation disorders, colitis, gum diseases, and assorted children's diseases. Some of these findings have been collected and published in the volume Medical Applications of Ozone, available from the International Ozone Association, 83 Oakwood Terrace, Norwalk, Connecticut, 06850. Some of the medical uses of ozone have been appreciated for years in Europe, Brazil, and elsewhere, as well as its advantages over chlorine for water treatment, but it's still relatively unknown in the U.S. Oxygen water. A much simpler type of oxygen therapy uses hydrogen peroxide, which is what ozone O3 forms on contact with water. It can be taken orally if diluted with water to 1/200th or less, absorbed through the skin by bathing in it. Anywhere from 1 to 8 points of 3% peroxide is a standard size bathtub half full, or in severe cases it can be injected, 250 cc's of 1/10%. Injections obviously require a physician's assistance, but self-treatment is possible with oral and skin applications. The principle is the same with ozone blood treatment. All hostile microorganisms prefer lower oxygen levels than the body cells require to remain healthy. Boosting the oxygen level revitalizes normal cells while killing virus and other pathogens. Domestic sales of hydrogen peroxide are rising at 15% per year as the news of this option spreads at the grassroots level. The rapid expansion of the peroxide movement is especially remarkable considering there has been almost no media coverage, and in fact the FDA, American Cancer Society, and other enforcers of established medicine have tried hard to discourage the practice. Hydrogen peroxide is the only germicidal agent composed only of water and oxygen. Like ozone, it kills disease organisms by oxidation as it spreads through the patient's tissues. It also destroys cancerous growths which are anaerobic. Nobel Prize winner Dr. Otto Warburg demonstrated over 50 years ago the basic difference between normal cells and cancer cells. Both derive energy from glucose, but the normal cell requires oxygen to combine with the glucose, while cancer cells break down glucose without oxygen, yielding only 1/15th the energy per glucose molecule that a normal cell produces. This is why cancer cells have such a huge appetite for sugar, and also why people who consume excessive quantities of sugar tend to get cancer more often. The anaerobic breakdown of glucose by cancer cells forms a large amount of lactic acid as a waste product, the same substance is formed by fermentation of glucose as in spoiled milk. The liver converts some of this back into glucose in an attempt to salvage a food source from a toxic waste. In doing this, the liver only uses 1/5 the energy per glucose molecule that a normal cell can then derive from it, but that's 3 times the energy a cancer cell will get from it. The more the weak, deranged cancer cells multiply, the more energy is lost to the normal cells. Thus we find that low levels of both oxygen and energy tend to occur when cancer is present, and vice versa. This wasteful metabolism becomes self-sufficient, self-sustaining, and dominant unless the oxygen and or energy levels are sharply increased, or the cancer's food source is eliminated. Heart transplant pioneer recommends oxygen water. Dr. Christian Bernard, who performed the first heart transplant, said in March 1986 that he was taking peroxide and water himself several times daily to reduce arthritis and aging, and he recommended it highly at that time. Since then, he has come under heavy attack by the medical establishment for this position, and now states that he is not involved with the peroxide movement. But he does not retract his original endorsement, nor deny that he still uses it personally. Over 100 physicians are currently carrying a broad assortment of incurables with this natural antimicrobial agent. This includes some 40 or more in the USA. A principal liaison to these free-thinking physicians is Dr. Charles H. Farr, who wrote, the therapeutic use of intravenous hydrogen peroxide. He directs the International Bioxidable Medicine Foundation and publishes the IBOM newsletter, which contains procedural updates and technical refinements for physicians using intravenous H2O2 therapy on their patients. By classifying the treatments as experimental, they can get around the FDA's archaic restrictions for now, until massive public demand and/or medical exposure force official approval. Dr. Farr summarizes the beneficial effects of H2O2 in IBOM Issue 2. These include killing bacteria, protozoa, yeast, and virus, oxidizing lipids from arterial walls, increasing oxygen tension intracellularly, stimulating oxidative enzymes, returning elasticity to arterial walls, dilating coronary vessels, and regulating membrane transport. H2O2 can be self-administered. The oral and skin applications offer the option of home treatment, as no blood needs to be drawn, and hydrogen peroxide is cheap and plentiful. Keep it diluted though. In high concentrations, it can irritate sensitive skin and induce vomiting when ingested. Veterinarians routinely give common 3% hydrogen peroxide to animals that have swallowed poison to make them throw it up. The starting dosage is 1 ounce of 1/200th H2O2 in water, and some will find they need to start with less. As the peroxide contacts pathogens in the stomach, it liberates free oxygen, so those with high levels of virus and streptococcus in their stomachs may feel slight nausea when the reaction is occurring. The dosage is increased by 1 ounce per day, up to 5 ounces on the 5th day, then finally up to 5 ounces 3 times daily for a week, or until the disease is no longer present. Then the dosage is tapered back down over a 5-week period. Food grade or reagent, these are 35%, dangerous if undiluted, is better for internal use, since the common USP 3% hydrogen peroxide contains small amounts of chemical stabilizers and other impurities. It can still be used if food grade is unavailable, it just isn't as pure. An alternative dosage regimen uses 3 drops of 35% H2O2 in a glass of water 3 times a day, which is increased by a drop per dose per day, up to 25 drops per dose in extreme cases. Candidiasis victims should start at 1 drop per dose and build their tolerance gradually. Some find the taste rather bleachy and unpleasant and may wish to chase it with plain water. It may also be mixed with fruit juice, and citrus juices in particular cover the taste pretty well. Adding 7 drops of 35% H2O2 to a gallon of drinking water and shaking well purifies it and gives it a pleasant waterfall-like flavor. For more dosage details and extensive references to H2O2 to a gallon of drinking water and shaking well purifies it, these gentlemen have continued the research initiated by Dr. Edward Carl Rosenau. They have located over 4,000 peer-reviewed medical articles on the applications of hydrogen peroxide, some dating back to the 1800s. They received the National Health Federation's Pioneer Award in Medicine 3 years ago for this ongoing research. Walter Grotz in particular has been touring and lecturing extensively on the benefits of self-administered H2O2, literally saving lives as he goes and bringing hope to people who have been told that their cases were hopeless. Dr. Kurt W. Donsbach at the Biogenesis Institute in Rosarito Beach, Baja, Mexico, 619-428-8585, has received a remission rate exceeding 70% in over 300 patients, at last count, most of whom had been previously told they were beyond hope and had tried everything else. Bioxidable therapies are now applied to all cases that arrive at this clinic, and all respond except for some of those who arrive already very close to death. The Guadalajara Medical School, Mexico's largest, is initiating their own tests this summer and will add it to their curriculum upon verification. As Dr. Donsbach has pointed out, no U.S. clinic or institution has ever tested intravenous H2O2 as a treatment for cancer, so any claim that is not effective or is not based on clinical trial and amount to willful disinformation. The Gerson Institute and La Gloria Clinic in Mexico are also using hydrogen peroxide therapies on their patients after the staff tested on themselves and found it to be beneficial. Hydrogen peroxide in nature. Hydrogen peroxide occurs naturally in rain and snow from atmospheric ozone and in